Hello friends, this is Vijay Mahajan and we are going to talk about the various types of headache today. Headache is generally divided into two categories, primary and secondary. First we'll talk about the primary headaches which usually arises from the scalp or the face. First is the migraine, which usually starts from the center of the head up to the upper border of eyelids and involves the unilateral portion of the head. It is also known as throbbing type of headache and is usually accompanied by some aura. Aura means there is exposure to very bright light or very high amplitude music. The patient may have nausea, vomiting, and accompanied by headache. So it is relieved by medication, but patient has to take treatment for at least 3 months. Then comes our cluster headache. Cluster headache also starts from upper eyelid up to the zygomatic process, or it may extend up to the mandible. Sometimes this cluster headache is also seen arising from the middle of the cranium and reaches up to the arch of mandible. So what is the common example of this is trigeminal neuralgia, which is seen in the distribution of fifth nerve known as trigeminal ganglion, innervating the frontal, the maxillary, and the mandibular region. There are three divisions of nerve. So accordingly, we have divided the name, and such patients are given carbamazepine or the mazitol for at least 6 months to 1 year to relieve symptoms of trigeminal neuralgia. There are other modalities and treatment also available for this disease, but we'll talk about this later on. The third comes the tension headache, which usually comprises or involves the frontal region or the bifrontal region and usually starts from upper eyelid and involves our forehead. So this type of pain is usually seen in patients with stress or tension or related problems in our daily routine life, and such headache is usually controlled by analgesic and NSAIDs, non-steroid anti-inflammatory drugs. So there's nothing to worry about this headache. And the fourth comes sinusitis, sinus headache. It is usually seen in patients uh, whom there is exposure to very cold climate, or some patient had some viral infection in the past couple of days, and there is a history that he had some discharge from the nose or expectoration from the mouth, and such patients we refer to the ENT, or we take PNS X-rays or CT scan to rule out any obstruction in the nasal or ethmoid sinusitis sinuses, and accordingly we plan for treatment. So there are many interventions also for sinusitis, but these are managed usually by ENT surgeons, and and will further it is divided into frontal, uh, ethmoid sinus, and maxillary sinusitis. So then comes our secondary headache. Secondary headaches are usually due to some uh, underlying lesion in the brain or central nervous system or peripheral nervous system. The first common example is the word snoo. We have to write it down. S stands for subarachnoid hemorrhage. N stands for neurological deficit. O stands for sudden onset. The second O stands for other symptoms, and the P stands for previous headache. We'll start with the subarachnoid hemorrhage. The patient complains that last night or yesterday he had very bad headache and this is the worst headache in my life. So we have to plan for some CT scan or MRI to rule out any evidence of subarachnoid hemorrhage or subarachnoid bleeding, and we have to take such patient for medical emergencies and surgical intervention. Then comes the neurological deficit. We have to examine whether the patient is having any nystagmus or any neurological disorder or palsy associated with headache. So this should be such patient should be thoroughly examined with neurological examination to rule out such headaches. Then come the word onset, sudden onset. This is seen in patients with temporal arthritis and common carotid artery thrombosis or aneurysm or dissections. Such patients should also be taken for CT scan, MRI, or other investigation to rule out any abnormality in the neck vessels arising from subclavian or aortic arch supplying the brain, face, or the posterior fossa or the posterior scalp. No, if found, such patient should be immediately treated for medical emergencies, and patient may also complain of severe headache in the temple areas and over the uh, scalp in the parietal region. So there are other symptoms also associated with raised intracranial pressure, or the patient is if he had some stroke, or there is any SOL in the cerebellum or brainstem that can also evoke uh, symptoms of headache which may last longer, and the patient should be examined by CT scan with CT scan or MRI to rule out any underlying cause and to treat the cause. The last comes previous history. Any patient who earlier had meningitis or stroke or any history of hyperlipidemia should be examined thoroughly with blood examination or CT lumbar puncture or CT MRI may not reveal any underlying cause. So we have to plan for these other investigation like taking cerebrospinal fluid from the lumbar puncture or from the blood test to visualize any raised low density lipoproteins, very high density lipoproteins, and their ratios, and accordingly we treat them with statins. So patient is uh, responds well to all these secondary headaches um, with the various modalities and treatment, and I hope you have understood the basic of criteria of headache. If you have any query or questions related to this, you may call me or contact me anytime. Thank you then. Till then, goodbye. All the best. Thank you.